This is a case of a traumatic LASIK flap dislocation. This patient was referred to me 1 week after the initial trauma, with the flap being repositioned initially at the slit lamp. It is always recommendable to take these patients to the operating room to lift the flap and remove all the epithelial cells from the stroma, as well as from the stromal side of the flap. But additionally, you also need to remove the epithelium further up to the limbus to minimize the risks of epithelial ingrowth. Alcohol 20% is another approach to minimize these risks, and you need to apply it over the stroma as well as over the stromal side of the flap. Once the stromal side and the flap side of the interface are free of epithelial cells, the flap can be repositioned, and we need to look carefully at the junction of the flap with the stroma. And if it is the case that a few days have passed since the initial trauma, it is also recommendable to remove the epithelium over the flap, as stria usually develop, and by removing the epithelium, it is usually easier to achieve a good and tight apposition of the flap to the stroma and minimize the risk of epithelium growing again into the interface. A semi-wet spear is usually very good to stretch the flap and achieve a good apposition. A bandage contact lens is required for a few days, after which it can be removed. With an early intervention, it is usually possible to recover the good vision in these patients.